Being addicted to drugs during your pregnancy is a scary thing. You want what's best for your baby, but you don't know how to come off the drugs or even if it's safe. Everyone gives you advice, but who do you trust? You want to talk to your doctor about your problems, but you don't want to get in trouble. Or worse, you don't want your baby taken away from you. You're embarrassed and you don't even know how you got to this point. We understand that you are afraid and you feel alone, but we're here to help you. We want you to be the kind of parent you want to be. We get it. The truth is, babies who are born to mothers who use drugs during their pregnancy have a high chance of going through withdrawal at birth. Compared to other infants, babies born to drug-addicted mothers stay in the hospital longer. They have more serious medical and social problems in the long run. These babies can cost nearly 6 times more and are 18 times more likely to enter state custody.
I think for a mom who's expecting, if they could realize what their options are, that continuing with drug use during their pregnancy can lead to obviously not the most positive outcomes at delivery. You do have a baby who oftentimes experiences signs of withdrawal, and it's hard to watch that because you know that there's not a whole lot you can do at that moment. That's not the happy image that you dream about, that you think that you're going to have this new baby and have this perfect baby to hold. You don't have to deal with the baby being transferred and being separated from baby at birth. You don't have to deal with consequences in regards to the potentials of DCS being involved.
As a care manager, we meet with all of the OB patients at least one time, and we just kind of get a feel for any needs that they may have, any struggles they may have, and linking them to resources, ideally in the community. We do see women who have had drug issues or may be using currently even though they are pregnant, so we try to link them right away, whether it's detox services or just inpatient or outpatient treatment, whatever the need may be. We have partnered with this program of MIST with Ridgeview, and it's a wonderful program. It's a partnership, it's a support program, because we want to see them succeed. We don't want to see them lose their baby. We don't want to see them lose things in their lives, their homes, their cars, their license, whatever the situation is. We want them to have that partnership and that support system, and they don't always have the support system, and so we're able to offer that to them right here.
We are working to reduce neonatal abstinence syndrome in Campbell County in Tennessee. Neonatal abstinence syndrome is a term used to describe when babies go through withdrawal. The biggest thing that I've heard from so many people who have been pregnant or who have babies now and have gone through this is to know that they're not alone. And I think that that's a big message that we as a community need to share, that you're not alone and we're here to help.
Whenever I first started using drugs was when I was a teenager. I just experimented a little here and there. I did anything from marijuana, meth to pills just to try to fit in. Before long, it was something I had to have to be able to function day to day. I was separated from my husband and my kids at one point in time. The MIST program makes it a whole lot easier when you feel like you can confide in somebody about your problems and they're not going to judge you. I just hope that anybody out there that's struggling with addiction, that they can come to the MIST program and have the sense of accomplishment that I have.
You can't do it on your own. You just can't. You have to have support. You have to seek help, and you need to seek it as quickly as possible. Because if you don't, you're going to lose everything. Being sober and being a mother is the most incredible thing I think I've ever felt. Because you don't miss out on anything. You don't take away from your kids to feed your addiction.
The truth is, the road ahead is hard. But we want to go on that journey with you. You are not alone. The staff at Dayspring Family Health Center understands that this is a tough time, and we're here to help. Through a partnership with the Mothers and Infants Sober Together program, The MIST program, we are committed to providing you with the best care for you and your baby, while giving you the tools you need to become and stay drug-free. Our goal is for our patients to deliver a healthy baby and help our mothers and families stay drug-free. For more information, call us at 865-481-6170, extension 1298.